have the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome to Pure Dog Talk. I am your host, Laura Reeves, and it's our favorite day of the month. Dr. Marty Greer is here to talk to us. And as you all know, Marty and I have our own new show called the Marty and Laura Show, which we're very excited about, and we're hoping that you're going to tell all your puppy buyers about it. But tonight, we're going to talk about lumps and bumps, the strange, weird, hooby-dooby, like Agatha's got a Who Daddy kind of like on her ass. And so, like, what kind
On
of
her
lumps
tushy.
and bumps? Yeah, bumps, lumps and bumps. There's all kinds of lumps and bumps. So we're going to talk lumps and bumps tonight. Hey, Marty, how you doing?
I'm great, thanks. And I brought Emmy Lou
I
tonight.
know you're lying, but you lie well. So,
Emmy Lou is
Who
here to
dat?
help us tonight.
Hi, Emmy Lou. Oh my God, I'm so excited. Pure Dog Talk gets a Danish Swedish farm dog. Yes. And my favorite one, too. Hi, Emmy Lou.
She's the best.
Okay. So with that, Emmy Lou and Marty are going to bring us lumps and bumps. So I had a very specific listener request for histiocytomas, and Marty said, well, we might as well do all the lumps and bumps. So let's start with histiocytoma, work through sebaceous cyst and all the other rando lumps and bumps our dogs can get, some of which are bad, some of which are just meh. So let's talk about it.
Sure. So we'll start with histiocytomas because they can be a little startling looking, and
they're kind of ugly and creepy and
they
gross.
They are. And if you look up histiocytoma in the dog, if you Google it and you look under images, you're going to find like 600 pictures because they are really, really common, and they are really scary looking because they're these pink bumps that show up on young dogs, and they come seemingly out of nowhere. Well, it's not completely random. It's usually on the head and neck or on the feet, the front legs. So it's pretty commonly seen there, not so much on the trunk or the back legs, but they can appear other places as well. And they are scary because they look like they're scary in a young dog. They start off as a little bulge, and then they'll have a scab on it, and fairly quickly that scab will peel off, and you'll see this red, aggressive looking lump. And if you Google it, you're going to be afraid that it's something like a mast cell tumor. And mast cell tumors are bad, terrible bad tumors. But histiocytomas are almost always in young dogs, not exclusively. I've seen it one in an 11-year-old Boston Terrier, so you can see it in older dogs. But they look scary because they're red and they're inflamed, and they get big really fast, and they can be really ugly. I had one on one of my personal dogs on her eyelid, and it was in the winter, and so she went out and it was itchy because it's a histiocyte. Histiocytes have histamine in there. Histamine is like the stuff that makes you itchy, like from a mosquito bite or an allergic reaction to something. And it was on her eyelid, and she went out snow plowing because it was itchy, and her eye swelled shut. And we were in Indianapolis when it happened, and so I had to go to a vet clinic and beg them, say, please, I'm a veterinarian, please, will you sell me a couple of prednisone tablets? And fortunately they did, because she literally had her eyes swollen shut. So this little tiny lump that should have been no big deal turned into a big deal.
So, okay. So the thing that I think is really critical here is it histiocytoma or is it mast cell? How do we know? Like, how do you, like, if I'm looking at my dog and it's got a red spot, how do I know?
Right. And even under the microscope, it can be confusing because the histiocytes have the same or similar granules to the mast cell tumors when you look at them microscopically. So it further confounds the issue, because not only does it look like a mast cell tumor to the naked eye, but it looks like a mast cell tumor if you look at it under the microscope. Excuse Emmy Lou. She's deprived. She's being deprived of all this attention.
You've joined us.
Yeah, isn't it nice of her
your
to
mommy needs
done that?
a little something tonight.
Yeah. Yeah,
So that was
apparently.
nice of you to join us.
So the biggest difference is typically the age of the dog. Like I said, I've
Okay.
seen a histiocytoma in an 11-year-old Boston that you thought was probably a mast cell tumor. And have
Mm-hmm.
I seen a mast cell tumor in a young dog? Yes, you can see
Mm-hmm.
that, but almost always a young dog under a year of age on the head, neck, or front legs, it's frequently, or feet, is frequently going to be a histiocytoma. And
Okay.
if you look it up, you can take a picture of it, look at it under on Google, and you'll probably find that there's something that looks similar to that. And they're also called button tumors. So if you can't remember histiocytoma, you can look up button tumor. And tumor means lump. Tumor doesn't mean cancer. So that's the first thing
Mm-hmm.
that we need to distinguish is tumor doesn't have a definition of being malignant or cancer.
Right.
So typically we will give steroids and or Benadryl and be patient with it, and they will almost always regress on their own within a few weeks. So they
And
come fast and then they go away. And it's very
what
cool because
causes it?
we don't really know except that it's young dogs that develop this. Excuse
Okay,
her.
everybody on YouTube, or if you're not on YouTube, you need to go to YouTube because Emmy Lou kissing Marty upside down in her lap is 100% worth the effort.
Well, you guys have all seen dogs kiss people before. It's
I
not that
know, but
unique,
it's
but
really cute.
she's very charming tonight. She's trying to be the center of attention and
She's
not,
she's
she doesn't want Laura
succeeding.
to be, yeah, isn't she? So,
Okay,
yes,
so if it's a young dog, it's more likely to be histiocytoma
correct,
and benign, right?
correct.
And if it's an
Yes,
older dog, it's more likely to be a mast cell tumor and not necessarily benign. Yes?
correct. And
Okay.
so you can take them off, but typically within 2 to 4 weeks, a histiocytoma will go from nothing to being this kind of big ugly thing, and it's usually not bigger around than a centimeter. So
Hmm.
if it's bigger than a pencil eraser or a little bit more than that, then you should probably see your vet.
Okay.
But frequently they'll go away. The diagnosis can be done on what's called an impression smear. An impression smear just means that we take a glass microscope slide and we press it onto the lump a couple of times,
Hmm.
and then we put it under the microscope and take a look. Now, what's really cool, and some of you may know this and some of you may not, is that there's a new piece of equipment that uses artificial intelligence and pathologists, and it's called an imagist. And there will be other companies that come out with this equipment, but we can put the slide, we can stay in the slide, put it under the imagist microscope. It's like a little microscope that sits on our countertop in our lab, and a pathologist can magically come in and look through the microscope remotely. So they can sit in their lab in Maine or in Florida or
Wow.
wherever they happen to be.
Wow.
They can look through the microscope at our microscope, and they can look at the cells and they can move it around and they can look at it. And within 2 hours, we can have a diagnosis back from a real live pathologist. Not just
Using
Marty Greer
AI.
looked. It uses a combination of AI and human beings.
Okay.
And it's super cool because in 2 hours, I used this yesterday twice. In 2 hours, we can get an answer back on what's lurking under your dog's skin or living on the surface of your dog's skin.
Wow.
It can be an ear cytology, it can be a stool sample, it can be a urinalysis. There's all kinds of things that, so anything your vet would look under the microscope for or in the past, if they have this Imagist equipment, and like I said, Imagist is the first piece of equipment,
Sure,
and it's
sure.
made by Zoetis, but there will be other companies that come to market with comparable equipment based on, who's developing what.
Right, right, right.
But you can, in 2 hours, you can have a pathologist take a look at your sample. So instead of worrying about this for 4, 5, 6 days for the sample to be sent in and then to get an answer
Right.
back and talk to the pathologist and back and forth and all the stuff, you can have an answer in 2 hours. It is
Okay.
really cool.
So Marty, I'm just gonna throw this down. Like I have been kind of hmm, I'm not gonna go with anti AI, but
Hmm.
not super in favor.
Hmm.
This is the very first thing I've heard that makes me say, okay, like I'm
Hmm.
cool with it. That's nice. That is amazing. And
Yeah.
science doing something positive like that, I love
Mhm.
that.
Yeah. It's really cool because, yesterday I had a sample that I looked at under the microscope. I had a client that was there. She had 3 lumps on her dog that they were red, pink, fleshy.
Mm.
Um, they'd shown up at 3 different times. They weren't histiocytomas, but it was really kind of hard to tell what they were. And it's a 4-year-old golden retriever, and we know what golden retrievers like to do. They're like boxers and Bernese Mountain Dogs. They like to go cancer. So within 2 hours, I was able to call her back and tell her what I thought we needed to do so we could develop a treatment plan for the dog. And based on that information, decide, do we take this lump off? If we take the lump off, do I need to just sort of skirt around the edges, or do I need to take a big wide excision so that we can get the whole thing? What does this mean to the dog's future? Should we go to surgery, not go to surgery? All the stuff. So it's actually really great information. So it uses artificial intelligence to read fecals, it uses it to read urinalysis, and then there's this whole thing with the pathologist. So yeah, there's some pretty cool stuff.
That's super cool, and I love that. Okay,
Yeah.
so histiocytoma, heritable, not heritable, just a thing.
It's probably heritable. There's more common in certain breeds than others. So anytime we say that there's a breed predilection, that means that there's probably a heritability component to it. I usually don't take them off surgically unless it's a dog that the owner is either really freaking out, or it's in a really unattractive place and the dog needs to get in the show ring, and it's going to take it weeks to go away instead of an hour to take it off and let it start healing. So depending on the situation, where it's located, all that, then we make those decisions. They're not serious, but they can look scary. So like I said, a Benadryl, like a diphenhydramine cream, can help. Diphenhydramine Benadryl will help as well because it's histamine. It releases histamine, which is why they're itchy. And Benadryl is an antihistamine, so it helps to shrink them. It's not going to make them go away that much faster. I used to work for a vet a million years ago that would say, well, we're going to inject it with a steroid and it's going to go away, but it would go away anyway. So, the question is, do you feel like it's going to go away faster with an injection or with Benadryl, or are you just going to kind of do something? Because if a client comes in and they're in a minor panic over this thing, should you do something? And sometimes veterinarians, to be very honest with you, do something just because they feel like your expectation is that. And so do we always make brilliant decisions on, well, here, honey, here's a bottle of amoxicillin, or here's a tube of Panalog. You go home and you just put this on and it'll be okay. Sometimes you feel like your vet might be getting pressured by you. So be sure that you're being reasonable at the vet clinic and that you're not just expecting them to do something for the sake of doing something. Like, you paid me money to come in, and now I have
Like, I
to
have to
make
do
you
something other than tell
feel
you it'll
good
go
about
away.
it. Yeah, I'm going to make you feel good about your decision to come in because here's something you can do at home, when sometimes you didn't really need to do anything because it was going to get better on its own.
That is fascinating little tiny tidbit.
Yeah,
Okay, so histiocytoma, mast cell, which actually is like bad, deadly
bad. Yes, it's very bad.
And so we see those in older dogs, and they
Mm-hmm.
present relatively similar.
Mm-hmm.
And so if you see some weird red spot show up on your dog and it's 5 or 6, you really need to have that looked at.
Yeah, and it depends a little on what it looks like. Now, we can see sebaceous cysts, and they tend to be kind of knobby little lumps, and they're not serious.
But they're
They're
not red and inflamed. I
no,
mean, a sebaceous cyst,
no.
like I've literally, when I was, doing the introduction, I laughed. Agatha's got one on a hip bone. Like,
Mm-hmm.
it's a sebaceous cyst. So
Right.
you do your talk on this. I know what I've been told, but I want to hear what you say. How do I know it's just a harmless cyst versus something I should pay attention to? Like, I can
Right.
determine that at home. Tell me your way to tell people that.
There's not always a good answer to that because sometimes they can be difficult to tell the difference on. Um, if you're worried about it, then you should go in. I'm just going to say you should go in. Now, if the dog has, 6 or 8 of these little small kind of knobby things with a little crust on the surface, they're probably sebaceous cysts. And dogs that grow them tend to have multiples. And there's actually kind of 2 kinds of sebaceous cysts. There's the kind that's a little wart. It looks kind of like a wart, but dogs don't usually get warts on their skin. Or there's the little pockets under the skin that have that kind of cheesy material, and people are always tempted to squeeze it. Don't do that, because then you open it up and it can get infected and it can bother the dog. So the temptation is like squeeze it and get it to go. No, 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 don't
No
do that.
Dr. Pimple Popper here.
No, 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 not a good idea. So if you're concerned, it's best to go in. If your groomer notices something, because sometimes the groomer finds things that we don't as veterinarians or as owners, because they've got their hands all over the dog and they're, hands on every 6 to 8 weeks. So there are definitely things that groomers pick up that even owners don't pick up. If it's anything on the mammary chain along, especially in a female dog, I've never diagnosed mammary tumors in male dogs, but it can occur. If you feel anything along the mammary chain, especially if the female wasn't spayed young, trot in, get it checked out, and aspirating those. So there's a lot of masses make a lot of sense to put a needle in it and see what it looks like under the microscope or under the imagist. If it's a mammary tumor, do not aspirate it for two reasons. One is it could potentially cause that to get to spread, and two is looking at it under the microscope isn't very helpful because they tend to be a tissue of mixed type. So if your vet sticks a needle in part of it, there may not be getting a representative sample. So you want to just take that thing off and have it sent in. So if it's on the mammary chain, and especially if the female's intact and was recently in heat, trot in, get on your vet's surgery schedule and get that taken off. So really there's a lot of variability in how this works.
Okay, so what I was taught, told, learned, assimilated into my brain was that if it was one of those little bumps and you could separate it from the tissue, right? Like it was just in the skin, and when you put your finger around it, there was obviously a lump, and then underneath that was the tissue. That was kind of meh. But if it was
No.
attached to the tissue, so that's wrong.
Yeah, no. It's not always the case.
Interesting. Do
Yeah,
tell.
the dog I saw yesterday, I'm pretty sure is going to come back cutaneous lymphoma. And those you could very clearly demarcate, very clearly lift up. They were very clearly in the skin. And cutaneous lymphoma is pretty rare, but that's what it looks like it's going to come back once we send in the tissues from biopsy. So no, that's not in and of itself a distinction or a distinguishing feature. So, just basically, if you've recently noticed it, you should probably make an appointment. If your vet is going to be able to see you for something else, like you're due for vaccines or whatever, heartworm tests, whatever it happens to be, make sure you mention it. And my strongest suggestion to you is when you find that lump the day or two before you go in, mark it. If it's a dark colored dog, mark it with whiteout or fingernail polish. If it's a light colored dog, mark it with a Sharpie marker, because there's nothing much more frustrating for your vet is for you to come in and then say, well, I can always feel it when I'm in bed. Well, we're not in bed. We're at the vet clinic. And so you're going to have to like find where this thing is and show it to me. So mark them all clearly. We have a little body map that's a drawing that you can mark where they are on the dog. So if you're not sure, you can pull up a body map on the internet and put some marks on that and show it to your vet. But if there's 2, 3, 4, 8, 12, whatever, have them all identified before you go into the vet clinic so that it saves everyone a lot of aggravation and a lot of time. And your vet fairly quickly can say, oh, this feels like a lipoma. I don't think we need to be concerned about it. Or this thing feels a little more firm, or it doesn't look right to me. We need to aspirate. We need to remove it. We need to do something, because there are definitely masses that need to come off, and they, depending on where it is and how it comes off and the dog's temperament, some of them we take off with a local block, some of them we put them under anesthesia for. So every situation happens to be a little bit different. If they're under the skin like a lipoma, a local block's not going to cut it. If it's a little tiny warty thing and it's on your dog's foot and they keep biting at it and chewing at it and it's making you crazy, sometimes a local block is all it takes to get them taken off, with a local or with a cryosurgery or with laser surgery. Excuse Emmy Lou. She's
okay, so here's another one. So we did mast cell and the other
histiocytoma.
Histiocytoma. Wow. Lipomas and sebaceous cysts. Again,
Yeah.
similar doodads, not similar outcomes.
Right. And the problem with lipomas is they can feel like a subcutaneous mast cell tumor. They
Mm,
even sometimes aspirate like one. If you put a needle in it and you don't get into the heart of the mast cell tumor, you may miss that part of it. And mast cell
mm,
tumors come in different versions and varieties as well. So, you need to work with a veterinarian that you trust, a veterinarian that has good clinical judgment and that makes good decisions on what goes to surgery and what doesn't. Because every single little lump doesn't need to come off. But there are
right.
definitely some that you just and after on many years of putting your hands on dogs, you're like, "Oh yeah, this is
You can
bad,"
feel,
or
right.
or "Yeah, yeah, yeah, no, this is okay. We'll take it off next time we do a dental. You'll be fine."
Right.
But there are definitely lumps that need to come off sooner rather
Mm,
than later.
mm,
And people are always under the impression that if you take it off, that you're going to make it spread or it's going to
mm,
get bad
mm,
faster. And
mm.
the answer is really that's not the case.
Okay.
You need to go in, take it off, take good enough margins that it's not likely to come back. But there are some masses that have little finger-like projections, and no
Mm,
matter
mm,
how careful the surgeon is, they can sometimes be recurrent. And there's kind of two kinds of serious masses. They're the kind that are locally invasive and are likely to come back, but they're not going to metastasize to other organs
mm-hmm,
like the lung, like the liver, other things like that. And then there's the bad ones that they're just going to spread. So they're gonna spread to the other organs like mast cell tumors.
Is
So
there a way? So, I mean, this is a horrible thing to ask you, but is there a way that I'm like massaging my dog and I feel a boo boo and it's got a lump? Is there a thing that says to me, as the owner of this dog, holy shit, this is bad? Or
mhm.
meh?
It could be really hard to tell as an owner. And I'm not trying to discredit people. It's
No,
just it takes
I'm
some clinical
asking. I mean,
experience. Yeah.
seriously.
It takes clinical experience for some of these things to really know. Lipomas tend to feel kind of fleshy, but mast cell tumors under the skin can too.
Mm,
So sometimes you just have to take your dog
mm,
in, pay the money,
mhm.
have your vet take a look. You don't have to run to the emergency clinic on Sunday night, but
Sure.
within a week or two of the time you find something, if you're concerned about it, it's much safer to go in and have your vet say, no big deal, don't worry about it, you're going to be fine, rather than to find out you've waited a year too long. And by the time you come in, and I have seen some masses where they have been gigantic
Mm,
and they're just miserable for the dog and miserable for you as an owner. So please take them off. I hear this over and over again. People say, well, I'll just watch it and see what happens. Okay, well, I can tell you what happens when you watch it. It's going to get bigger.
mm,
So take it off while it's small enough that it's manageable in an area that we can get to it effectively, because parts of the body are easy to remove lumps from and other parts are not. Like
mm,
if you look at like the eyelid, it's pretty tight. If you look at the skin on the back of your hand, if you have to take a 2-inch
mm,
thing off of there,
mm.
you're going to have a hard time putting the skin back together. If on the other hand it's along my rib cage, there's a little extra there.
Oh,
You
yeah.
can pull that together.
Agatha's lumps on her, literally on her ass. Like, it'll be
Yeah.
okay.
Yeah. Yeah, because there's extra skin in some places.
Sure, sure.
The top of the foot, the
Yeah.
eyelid, there's that on the face, those are hard places because there's not a lot of skin to put back together. Ears. On the body, on the trunk, it can be
Mm,
pretty easy. So again, you have to use some common sense as the owner to say, is this something that I need to have seen? And seriously, watching it just means you're going to watch it grow and grow until the point that it's either locally invasive or is going to spread to other organs, and then you've waited too long. And I've actually had a fair number of those happen.
mm.
So you want to take it
Okay.
off while it's still small. Now there are treatments for some of these diseases like histiocytomas.
Mm,
They go on their own. Mast cell tumors, there's palladia, there's chemotherapy for it. Lymphoma, there's chemotherapy for those. Just depending on what it is, there's also radiation therapy for some of these masses, and that gets to be very expensive. So does Palladia and some of the other chemotherapeutic drugs.
mm.
So get them when they're small, get them when it's not going to cost you a fortune, get it taken care of when it's still easy to take off surgically, because a chance to cut is a chance to cure. So
Mm.
don't wait until you regret waiting so long, because I'm going to guarantee you it's going to get bigger.
Okay. Okay. So my next one, this is like I'm throwing down on the lumps and bumps. I in my time, I've been not only a professional dog handler, but also a professional pet groomer.
Mhm.
And in my pet grooming days, I have worked with any number. You said dogs don't get warts on their skin. I'm like, have you seen a Cocker Spaniel? I
They're
have.
not warts.
What are they? Because when I shave a Cocker Spaniel who's like, I don't know, 12 inches long, and there's 100 half an inch long doodads off, and I can't shave it without shaving off a thing.
Yep.
Oh,
Those are
oh.
sebaceous cysts. There's
They're
only
this long?
they can be skin tags or they can be sebaceous cysts.
Ooh,
Now, there are warts. Rarely we see warts in dogs. If we see warts, they're viral and they happen in the oral cavity,
yeah.
almost always in a young dog. Yeah. And they can have hundreds of them. They're often viral. They are often spread through
Papilla.
papillomas. Yep.
Yeah.
Viral papillomas. And you can actually have a vaccine made for those because it's a virus.
Mhm.
But those are warts. Those are a really different, completely different thing than the things we see on the skin. So the things on the skin are sebaceous cysts, skin tags, things along those lines.
Hmm.
And yes, there can be bunches of them. And sometimes we do have to remove lots of them off of dogs because they keep growing them in awkward places and places they can bite at and chew and those kinds of things. But those are not technically warts. So slang term is wart, but it's not technically a wart.
Interesting. Because I am scarred for life and need therapy over the Cocker Spaniel that I had to shave. That was literally his entire skin. There
Yeah.
was not, I couldn't shave 2 inches without
Mhm.
some sort of growth on his
Yeah.
skin.
Yeah.
It was
They're
really terrifying and gross.
yeah. Yeah. And the groomers are pretty careful most of the time.
Mhm.
Groomers amaze me. They are
I,
talented
I,
people.
I know.
They have little cards where they mark all the little lumps, and I don't know how they zig and zag and the dog doesn't get their tongue in the clipper or the scissors. I totally admire the groomers because it is a very difficult job. And there are some dogs that come to the vet clinic that are nasty little creatures,
Mhm.
and the groomers are they're like charming these dogs into cooperating. I'm so impressed by that.
I know. Krista comes and tells me all the time. So my gal that lives at my house, she's like one of my kids. She works at the vet clinic and she's constantly telling me stories. She's been a professional groomer since I started teaching her how to groom dogs in Nebraska like 18 years ago. And she's like, I can trim this dog's nails. It'll be okay. Would you all just leave? It really
I
is true.
know.
Those of us who have
I
done
know.
professional grooming, it really is a skill set. But that particular cocker goes back to, dear God, like
Mhm.
my college days, and it still
Mhm.
haunts me.
Oh, I know.
Okay,
You're
so
right.
not really warts, got it. Um, what other lumps and I mean, so the really, really bad ones are what we think of, like bone cancer. That doesn't really feel like a lump, right? It's like a mushy spot.
No.
So let's kind of throw that into the mix of lumps and bumps real quick.
Oh, bone cancer. Bone cancer is a very serious disease,
Mm,
almost always seen in giant breed dogs, more commonly in males. That being said, I had a corgi that had osteosarcoma, so you can certainly see it even in small dogs. More common in dogs that are neutered or spayed when they're young. And it's usually in one of four locations in the dog. It's usually either the upper part of the front leg upper, like near the shoulder.
mhm,
They don't ever cross the joint on an x-ray. You can tell the difference. Down here at the wrist, so on the front leg, as far from the elbow as you can get, up high or down low. And in the back leg, usually just above the knee and just below the knee, the
mhm,
stifle,
mhm,
the actual knee joint. Now, that being said, the last dog I saw, it was down at the hock. It wasn't at the normal place, but almost always giant breed dogs, Rottweilers,
I
Wolfhounds,
I lost a wire hair to one, so yeah,
Berners. Yeah. Yeah, but when you find it in a corgi, yeah, you're like, wow,
that's
he really
weird.
broke the rules.
I mean,
He
wire
wasn't
hairs are
neutered
weird,
young.
but corgis are really weird.
I know. He was not neutered young and he
Yep.
was the wrong breed. And it showed up first as a metastatic lesion in his chest. He broke every rule in the book, but those things happen.
But okay, so we're in the lumps and bumps department. How does that feel? Like the wire hair pointer I had
Hard.
that we lost to bone cancer didn't live with me at the time. So describe how that feels when you touch their leg or what have you.
Hard, hot, They're acutely painful. They stop walking on the leg very effectively, and they can fracture the bone pretty easily. So you want to be extremely careful with those dogs. There is not a great treatment for it at this point, although there's a few dogs that will put on the drugs that we use for osteoporosis and osteopenia in people that can slow the progression. But even a limb amputation at this point has not typically been life-saving for dogs. So unfortunately, it's an ugly disease that progresses quickly, and it's painful, and it's one of the baddest things you can get. So yeah, I actually have a friend that died, a human friend that died of it. So it's a bad disease.
Like I said, lost a wire hair to it. One of my old Borzoi clients that I was showing at the
Yep.
time
Giant breed. Yep.
went down with it. Wolfhounds, obviously one of my primary
Mm-hmm.
clients that it's huge in.
Mm-hmm.
Okay, so in the lumps and bumps category, that's the ugly end of the version, and none of the others we've
Yep.
described will have that heat. Am I understanding that correctly? That's the
Not
one that has
normally.
heat. Like
Yeah.
it's hot. Like it feels hot.
Yes.
Okay.
It's an ugly disease, so try not to get it.
Yeah, we're gonna all avoid it, but I want people to kind of have a way to know a little bit what they're dealing with. So
Yeah, and it shows up pretty characteristically on an X-ray. You usually don't need a biopsy to confirm it. Usually, if you have a radiologist that looks at the X-ray, you can get a pretty good idea whether that is what's going on or not. So yeah, it's pretty ugly.
all right, Marty. I hate to end on an ugly note. The good
Oh,
news
I
is
know.
we're off to talk about other stuff on the Marty and Laura show. So y'all need a palate cleanse. Just hop over to the other pod.
It'll be a little lighter
It
hearted,
might
a
be a
little more
little bit
fun.
lighter. Thanks, Marty. Always, always, always appreciate you. Good night, Emmy Lou. We love you. All right.
Bye.
Perfect. Bye.